and answer them to the best of their abilities. We ask that you direct your question to the person you are addressing in the chat box. And as always, Brooke Barnes of the Scott County Health Department will be the moderator. Nita, please start us off with reporting Scott County's numbers, Rock Island County's numbers, excuse me.
The Rock Island County Health Department, unfortunately, is reporting 2 deaths of patients who've had COVID-19, a man in his 70s and a woman in her 90s. The total number of deaths in Rock Island County is now at 9. Today is the first day that we've had to report more than 1 death, and we are very saddened by every one of our residents who have lost their life to this illness. We do send our deepest condolences to their families and friends. In addition, the health department has 22 new cases of COVID-19 today, bringing our total number of cases to 382. Currently, there are 19 patients hospitalized in Rock Island County.
Next, we'll hear from Ed Rivers with the Scott County Health Department on the numbers for Scott County. Ed?
Well, today, our Department of Public Health reported a total of 216 positive cases. That's an increase since Friday's number of 196, 10 on Saturday, 2 on Sunday, and 8 today. In addition, we were asked about the number of negative tests. Our Department of Public Health reports that there were 2,156 tests total. 216 would be 10%. That leaves 1,940 negative tests for 90%. In addition, Scott County is reporting 1 additional death that was posted over the weekend. We extend our deepest sympathies to the family of this person who was taken by this horrible disease. It continues to sadden us that it is taking members of our community.
Okay, Nita, we'll go ahead to you for your points for today. Please go ahead and share that.
Last week, Ed and I were asked about how well Quad Cityans were doing at following the social distance guidelines. And I had mentioned that when I went to the grocery store for my weekly trip, I saw many people doing a good job of keeping their distance, and about half of them were wearing their face coverings while out in public. I didn't have any other anecdotal data because I've been staying home myself and only going out for essential trips. But we did check into it, and according to the University of Maryland study analyzing cell phone location data, residents in different states may not be as diligent. Illinoisans have been under the stay-at-home order since March 21st, and that is scheduled to end on May 30th. Illinois ranks number 18 on the social distancing compliance list of the 50 states and the District of Columbia. Iowa doesn't have an official stay-at-home order, but there have been restrictions put in place since March. Based on the restrictions in place until today, Iowans ranked 36th on this Maryland study. Today, Iowa Governor Kim Reynolds announced loosening of restrictions in 77 counties, but not including Scott County. The previous restrictions set in place by Governor Reynolds will be extended for Scott and 22 other counties until at least May 15th. We share this data because there is one alarming trend. People are starting to stay home less frequently. This scares us because there is no cure for COVID-19. We don't have an offensive game. We can only play defense. There are no medications or vaccine yet, so our best defense are the ones you've heard from us many, many times over these last few weeks. We must keep saying them until there's a cure. This is the only game we've got. Remember, you control how you respond to COVID-19. Stay home as much as possible. Keep at least 6 feet between you and anyone else. Wash your hands frequently with soap and water for at least 20 seconds each time, and use hand sanitizer when you can't wash your hands. Cover coughs and sneezes with a tissue or into your elbow. Wear a face covering when you must go out in public for essential trips. And stay home when you're ill. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness that may appear anywhere to 2 to 14 days after their exposure. The CDC has recently updated its official symptom list. The original 3 symptoms were fever, cough, and shortness of breath or difficulty breathing. They have now added a few more symptoms to their list: chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell.
Nita discussed the continuing need for people to stay at home and make essential trips only, but there are some in our community that don't have that luxury because our community must go on and they have to go out and go to work to make sure that it does. And that's what we are in the Quad Cities, a community that rises when called to protect each other. On behalf of Nita and me, we'd like to say some thank yous. First, to our public health staff for maintaining a robust COVID-19 response over the course of many weeks. You have accepted the challenges of this response graciously, and we are proud to be a part of this effort with you. We are public health. And thank you to our health system and medical provider partners for their commitment to responding to those in need, whether due to COVID-19 illness or other medical concerns. Your abilities to put your pandemic plans in place make all the difference. And thank you to our local governments for immediately asking public health and healthcare what was needed. Your guidance supports the efforts of our community. Thank you to our emergency management partners. Your leadership and cooperation makes all the difference as we respond in a 2-state, 2-county community. Thank you to our local grocery stores and their employees for helping serve our more vulnerable populations and for showing up every day to make sure that the staples our community needs are available for us. Thank you to the workers in our community who are continuing to staff childcare, transportation, manufacturing plants, and many other sectors. You are the engine that is keeping our community running, and you are doing this while ensuring the safety of yourselves and your co-workers. Thank you to local businesses that meet many of our needs. We appreciate your willingness to listen to public health advice while continuing to serve residents. And thank you to our media partners who help us deliver our message quickly, reliably, and factually. You help us provide accurate information to the community to inform their choices in conducting the business of their daily lives. It takes an entire community to protect the entire community, and we thank you all for helping to protect ours.
Thank you, Ed. Next, we will hear from Roger Pavey with Community Action of Eastern Iowa. Go ahead, Roger.
All right, thank you all for the work the health departments are doing for our community, and thanks for inviting me today. I'd like to share with you 3 things that Scott County households could access that can help them through the pandemic. Number 1 is energy assistance. If a household has recently been laid off from work, they may qualify for an energy assistance payment using only their layoff notice. The average household benefit is $400, and the household does not have to be behind on their bill to qualify. Any Scott County household that has not already received a benefit since last October can apply, and the fastest way to do that is through our website, caeiowa.org. Secondly, if you are hungry and can't afford food or can't leave your house because you're quarantined or ill, Community Action will deliver food to your doorstep, usually by the next day, faster if you need it. Again, request food through our website with a very short form, or call us at 563-324-3236. Third, same thing with diapers. If you need diapers for your infant or toddler and you can't afford them or can't find them, please let us know by going to our website or calling us, and we will deliver them to your doorstep using contactless delivery. And then lastly, if a family doesn't know where else to turn for any need, please contact us and we will help them access the resources that they need in the community. We respond to resource requests 24 hours a day, including weekends. And if there's an emergency, we'll deliver food, diapers on a weekend, or help with any other need. Thank you.
Thank you very much, Roger, for joining us today, and also Ed and Nita for responding and providing the comments for today to help inform our community on what is latest for COVID-19. Next, we'll go to the questions. Please type them in here. And we have a number that we were able to respond to in the chat, so please check those if you have related questions. The first question is for Ed. Has there been any explanation given as to why Scott County wasn't one of 77 counties where restrictions were eased?
The general explanation is in Scott County, our cases continue to increase. We look more like Johnson, Lynn counties than we do the counties in the rural areas where their cases have never been elevated or they're seeing fewer.
A follow-up question to that is, I saw a number of non-essential retail stores open today, such as Hobby Lobby and Dick's Sporting Goods. Are retail stores afforded the option to be open?
There is not a distinction between essential and non-essential in Iowa. That's a standard that's set by others and not local health departments. There are specific types of businesses in the governor's proclamation which are restricted, and there are those that are not. For example, used clothing stores. Clothing stores are closed, however, a store like Target, which sells clothing, is not.
Thank you. Please type in any additional questions that you have before we conclude the meeting today. Question for Nita. What does the age range of the 22 new cases in Rock Island County suggest to you? Multiple cases have been among teens, those in their 20s, 30s, 40s.
Yeah, I would just say that it appears that COVID-19 can affect anyone at any age, and it is still very prevalent in our community right now, and we need to keep the hand washing and social distancing going to protect the spread, or to prevent the spread.
Okay, seeing there's no additional questions, we're going to conclude for today, but we look forward to speaking with you again later this week on the next series of topics that we'll be sharing. Thank you. Have a good day.